PDA is a medical condition where the ductus arteriosus, which is a blood vessel that is supposed to close shortly after birth, remains open, patent. To help you to understand what PDA is, I'm going to draw simple pictures. What is the treatment of PDA? Welcome, Dr. Anita Stola. Today we are going to discuss patent Ductus Arteriosus PDA. PDA is a medical condition where the Ductus Arteriosus, which is a blood vessel that is supposed to close shortly after birth, remains open, patent. The Ductus Arteriosus is a vital fetal blood vessel that allows blood to bypass the lungs, which are not used for oxygen exchange before birth. In utero, the baby received oxygenated blood from the placenta through the placental vessels, and the ductus arteriosus connects the pulmonary artery to the aorta, enabling most of the right ventricular output to bypass the non-functioning fetal lungs and enter systemic circulation. To say it in other words, there is two vessels that come up from both sides of the heart, right side of the heart and left side of the heart. From the right side of the heart, the big vessel is called pulmonary artery because it brings blood without oxygen to our lungs and then comes back to the left side of the heart and through the aorta, now with oxygen, goes all around our body and provides oxygen to all our organs. When baby is inside mom in utero, that small vessel that is called ductus arteriosus connects those two big vessels, pulmonary artery and aorta, and shifts blood from pulmonary artery, so right side, to the aorta, left side of the heart. After birth, there are several physiologic changes that occur when the baby takes first breath. Lung expansion and increased oxygen levels. With the first breath that baby takes, the lungs expand and oxygen levels in the blood rise. Also, prostaglandins. This is a substance that keeps the ductus arteriosus open in utero. After birth, levels of prostaglandins drop significantly. Also, blood pressure in the aorta after delivery with the first breath increases as now the left ventricle, left side of the heart, takes over systemic circulation. These changes lead to functional closure of the ductus arteriosus within first 24 to 48 hours of life. So, most babies, term babies, will have that ductus arteriosus closed within a day or a couple of days. But there is also something that is called anatomical closure, where the ductus arteriosus is permanently sealed by fibrous tissue, and this typically occurs within first few weeks of life. If the ductus arteriosus stays open after delivery and the left side of the heart takes over, there is changes in the shift of that blood that connects those two big vessels, pulmonary artery and aorta. In utero, we had that shift from right side of the heart to the left side of the heart. Now, because left side of the heart is stronger, generates more pressure, that flow is reversed. Now it's from left to right, so there is more blood going to the right side of the heart and then to baby's lungs. To help you to understand what PDA is, I'm going to draw simple pictures. I'm not very good in drawing, but I hope it's going to help you to understand what is PDA and what implications it has if it stays open. So this is going to be our heart. Our heart has 4 chambers. This is left side of the heart and right side of the heart. Now we have 2 big vessels that come from each side of the heart. from the left side of the heart, the big vessel, it's called aorta, and this vessel brings oxygenated blood with oxygen to all our organs, tissues. From the right side of the heart, we have a big vessel that is called pulmonary artery. Pulmonary, it means lungs, that brings blood without oxygen to our lungs. Those are lungs. When baby is inside mom, babies are not using lungs. Everything is filled with fluid. Baby receives oxygen only through the placental vessel. So we don't need all that blood to go to baby's lungs. So we have that vessel here that connects those two, and it's called Ductus Arteriosus, that basically shifts blood from here to here, right side to left side, bypassing lungs. Now when the baby is born, they are taking first breath, air sacs are opening up, babies are breathing. We need that blood to go to baby's lungs now because the blood needs to get oxygen there. So blood goes from right side of the heart now to the lungs, gets oxygen here, comes back to the left side of the heart, and now through the aorta with oxygen goes to all our organs and tissues. So that vessel after delivery needs to close. It usually closes within 24 to 48 hours in term babies. In premature babies, it takes longer for several reasons. One of the reasons, there is less muscle tissue in that vessel that prevents closure, constriction of that vessel. I mentioned that the vessel closes within 24 to 48 hours, but it takes about 2 weeks for that vessel to close completely and be replaced with scar elastic tissue. In premature babies, when this vessel stays still open, after baby is born, with time, left side of the heart becomes stronger because it needs to generate more pressure in order to pump blood to all our organs and tissues. And as when the baby was inside mom, we had that shunt from right to left. Now, since that left side of the heart is stronger, that shunt reverses and now it's from left to right. So there is more blood going to baby's lungs. Lungs are overloaded with fluid, and that's why baby is starting to have some symptoms. Those babies usually require more oxygen and more respiratory support. I don't know if you can guess that this is the heart, but this is my simple picture that I hope that will help you to understand why we need to intervene and treat that vessel and close that vessel either with medication or eventually surgical closure. In PDA, patent ductus arteriosus, the ductus arteriosus then fails to close, leading to several physiological consequences. So as I mentioned, the shunt through that vessel, ductus arteriosus, changes from right to left, right to left to left to right. This can cause increased pulmonary blood flow. This can cause volume overload in the left atrium and left ventricle, and this increases the workload on the heart. Because of that shunt, and there is more blood going now to baby's lungs, there is excessive blood flow to the lungs, and that can lead to pulmonary congestion. Lungs are overloaded with fluid, pulmonary edema, increased pulmonary vascular resistance over time, so those vessels become constricted, they shut down, and that is causing something that is called pulmonary hypertension. Also, due to shunting of the blood into pulmonary circulation, systemic organs may receive less blood, leading to poor perfusion of systemic organs, for example, GI tract and intestines. This can cause also some potential issues for growth and development of the baby. chronic volume overload, heart overload, can cause left ventricular hypertrophy, which is enlargement of left side of the heart, dilatation of left atrium, and finally heart failure if PDA is untreated. If PDA is untreated, it can potentially lead to serious complications like pulmonary hypertension due to prolonged high blood flow and pressure, increased pressure in pulmonary arteries. It can cause to infection in the lining of the heart that is called endocarditis, and due to chronic overload, if PDA is untreated, it can finally lead to heart failure. Why PDA is more common in premature babies? It's due to several factors that inhibit the normal closure process of the ductus arteriosus. And here are the primary reasons. Number one, immature lung function and reduced oxygenation, reduced oxygen content in baby's blood. Premature babies have underdeveloped lungs, and in premature infants, lungs are often not fully developed, leading to lower levels of oxygen in the blood. Premature infants are also more likely to experience period of low oxygen levels, which is called hypoxia, which can delay ductus arteriosus closure. Ductus arteriosus is very sensitive to oxygen levels, and lower oxygen levels delay PDA closure. Also, premature babies have higher level of prostaglandins. Prostaglandin is that substance that keeps ductus arteriosus open. It's often present at higher levels in premature infants, and premature infants have also reduced ability to break down prostaglandins and clear prostaglandins from their system due to immature liver or immature kidney function. Premature infants have also immature cardiovascular system, and they have weaker response to pressure changes. The cardiovascular system of premature infants may not respond adequately to the changes in the blood pressure and flow that stimulate the ductus arteriosus to close, as compared to term infants. Also, in the ductus arteriosus, that vessel, there is less muscle tissue in premature babies, and the smooth muscle in the ductus arteriosus is less responsive in premature infants, leading to, it doesn't constrict, leading to delayed or incomplete constriction of that vessel. Also, premature infants may experience something that is called metabolic and respiratory acidosis, which are conditions that can also inhibit closure of ductus arteriosus. Kidneys in premature infants are less efficient, which can affect the balance of electrolytes and hormones that influence ductus arteriosus closure. The symptoms of PDA can vary depending on the size of ductus arteriosus, which can be large, moderate or small, and the amount of blood that flows through that vessel. In some cases, a small PDA may be completely asymptomatic, while the large PDA can cause significant symptoms and complications. The most common and first sign of PDA is something that is called heart murmur. It's an abnormal whooshing or swishing sound that we hear when we auscultate chest, and it's caused by turbulent blood flow through the open ductus arteriosus. Doctors usually detect it during the routine daily checkups when we listen to the baby with the stethoscope. Next symptom, respiratory symptoms, respiratory distress. Increased blood flow to the lungs that shunt from left to right, and overloading lungs with fluid can cause difficulty breathing and rapid breathing that we call tachypnea. Those babies often need more respiratory support, increased support from the ventilator, and they also require more oxygen to maintain good oxygen saturation. Infants also with PDA may be more prone to respiratory infections like pneumonia or bronchitis due to fluid accumulation in the lungs. Babies that have large or moderate significant PDA, they may have trouble feeding and they can exhibit poor sucking, or they can tire easily during feeding. They may also poorly tolerate any enteral feeding that can be manifested by abdominal distension or bilious vomiting or residuals. Those babies may also have slow weight gain and poor growth because they are just spending more energy, and we have difficulty in maintaining adequate nutrition. Those infants become very easily fatigued. They become easily tired with normal activities, daily activities like feeding or crying. If PDA is large and clinically significant and it's not treated, it can lead to some complications, and it can be manifested by enlarged heart, edema, which is swelling of the legs, ankles, or abdomen due to fluid buildup, increased heart rate, which is tachycardia or fast heart rate. It can occur as the heart compensates for the increased workload. The choice of treatment depends on the size of PDA, the severity of symptoms, and the age of the baby. Small PDAs may close on their own without causing significant symptoms and often have an excellent prognosis. Larger PDAs, which can lead to heart failure and other complications, require prompt treatment to improve outcomes. Here are the main treatment options. Watchful waiting in a case of small PDA, asymptomatic PDA. If PDA is small and not causing any symptoms, doctors usually recommend monitoring the condition. Sometimes the PDA may close on its own within the first few months of life. Number 2 option, it's medication. If PDA is large or moderate and it's causing symptoms, it's being treated with either oral or intravenous medications that are called non-steroidal anti-inflammatory drugs. This medication, such as indomethacin or ibuprofen, can help close a PDA by reducing the levels of prostaglandins, which keep the ductus arteriosus open. This treatment is most effective in premature infants. What are side effects of those medications? Those medications can have side effects such as kidney dysfunction because the medication constricts renal vessels, which can reduce urine output. It can also cause gastrointestinal issues, as it also reduces blood flow in the intestinal vessels. Those medications can also affect blood clotting, so we have to use them carefully and we have to monitor the baby while we are administering those medications. Another medication that we use to close PDA that is used more and more often, it's Acetaminophen, commonly known by the brand name of Tylenol. While traditionally non-steroidal anti-inflammatory drugs like ibuprofen or indomethacin have been used to encourage the closure of ductus arteriosus, recent studies have shown that Tylenol, Acetaminophen, can be also very effective. The exact mechanism by which Tylenol induces the closure of PDA is not entirely understood. However, it's believed that it also inhibits prostaglandin synthesis, which plays a crucial role in keeping the ductus arteriosus open. By reducing the levels of prostaglandins, Tylenol helps promote the natural closure of this vessel. What are the benefits of Tylenol acetaminophen? Number one, reduce risk of side effects. Tylenol is often preferred due to its lower risk profile compared to indomethacin or ibuprofen. It's generally better tolerated, and unlike ibuprofen or indomethacin, Tylenol does not constrict blood vessels, renal and intestinal, which is advantageous to infants who may already be experiencing compromised blood flow to kidneys or intestines. They are oral and intravenous forms of acetaminophen Tylenol. It can be administered by mouth or through the vein, providing flexibility in treating infants who may have feeding difficulties or other medical conditions preventing oral administration. When medical management with medications such as ibuprofen, indomethacin or acetaminophen is ineffective or contraindicated, surgical procedure that is called PDA ligation becomes a necessary intervention, and it's option number 3 in our treatment of PDA. The surgeon typically makes a small incision on the left side of the chest between ribs to access the heart and the ductus arteriosus. This approach, known as thoracotomy, allows direct visualization of PDA. The PDA is then carefully dissected and isolated from surrounding structures. The surgeon places a surgical clip or ties sutures around the ductus arteriosus to close it off. This stops abnormal blood flow between the aorta and pulmonary artery, and this is the definite treatment of patent ductus arteriosus. In summary, patent ductus arteriosus PDA is a condition where a vital blood vessel fails to close after birth, primarily affecting premature infants. Effective treatment options, including medication and surgical ligation, have significantly improved outcomes, ensuring most infants experience normal growth and development. Early diagnosis and interventions are crucial, and with advancements in neonatal care, the prognosis for PDA is highly favorable. Thank you for your attention. I'm happy to answer any questions you may have. Please email me, contact me at neonatologyforparents.com.